to share. And I'm glad that you think I'm an expert. It's just I'm an expert in my experiences and the knowledge that I have. And so I'm so glad to be able to share that with you and those that are watching us tonight.
Thank you. All right. So let's get right to it. So
Sure.
we as far as I know, we've had COVID-19 for a while now, but definitely we started seeing changes in early March, end of February. So since that time, walk us through what the last 2 months has been like for you as a medical professional.
Chaos, quite frankly, organized chaos in that context, Shaunte. That's a very great question that you asked. I'm sure I would speak not just for myself, but anyone currently working in the medical profession really had a crash course in change management and really had to learn the true word of adaptability and flexibility. And even though many of us have gone to school for whatever said profession, whether you're a nurse or physician or physical therapist or occupational therapist, whatever it is in the actual health professional realm, we all quickly became experts in understanding how COVID-19 has impacted our day-to-day operations, how we practice clinically, and how we care for our patients. The easiest word that I can share, maybe not one word, but 2 words, is information overload. As you are aware, and everyone watching, every day, particularly from the very beginning, even when we first heard about COVID-19 really impacting the US back in late December, early January. And then when we kind of got to the middle of February, the last week of February, I remember actually traveling to Boston, Massachusetts, March 4th through the 6th, I believe it was, for a nursing conference. And so right about the beginning part of that week, everyone started to get a little hesitant and wanted to really understand what was actually taking place. And so clearly, I remember very, very specifically coming back from that flight, from that trip as well, and being on that flight where people started having on masks. People weren't sure what to do. People were always afraid of, the recirculated air in airplanes, et cetera. And very instantly, that very next week, so that would have been probably the 8th or 9th or 10th of March, was when we really started understanding, hey, it's here and it's happening. And that's when those cases in New York really, really started to obviously make an impact, not just in New York City, but also here in the US, and where we really understood what is COVID-19 and why is all of a sudden it's become national news, international news, and how is it impacting me day to day. So a lot of information was coming. It was like drinking water from a fire hydrant, as you can imagine how difficult that would be. And every single day it was new information. Every day we had new huddles. Every day we were trying to learn how to best protect ourselves, best protect our team members, and best still provide the best care possible to the current patients that were actively in our hospital. And then, of course, most importantly, how to care and manage for these patients if they were positive entering into medical facilities.
Wow. So it's been so much information, all the doctors, all the scientists that we watch on the news every single day. Can you tell us from your perspective, what exactly is COVID-19? How is it transmitted? What are the new symptoms? Because I know they've changed as well. Just bring us up to date on that part.
So basically, COVID-19 is the novel coronavirus, and the key word in that is novel, meaning it's new. And so it's a new strand of a virus that is very much connected to SARS, connected to the common flu, connected to the common cold. And it is basically an upper respiratory disease that is spread from person to person, and it ends up having respiratory illnesses. And basically, the first, as we all are aware, the first common case that we're all aware of took place back in Wuhan, China. And subsequently, we learned that, as you indicated, the information has changed. You literally in the beginning just kind of had the common cold flu-like symptoms, cough, chest tightness, fever, chills, etc. The newest one, I think, if it is what we consider new, but over the last few weeks, the new symptom that many people have been describing is also a lack of taste and sometimes a sense of smell, and their taste buds, their sensory operations were a little impeded. And so I personally know of a friend who said he actually felt okay, but all of a sudden he could not smell, I think it was peppermint oil. And literally, if you know, peppermint oil is very strong, and he could not smell it at all. And he, had it at his nose, and he's like, something is wrong. And then he, later on that evening, went to eat dinner, and whatever it was in his meal that night with peppers or something, he could still eat, but he didn't have a sense of taste. His taste buds were not there. He went and got tested the next day, and it was about 2 days later was when he started to have the general malaise, the fatigue, the chest tightness, etc. And that was when those other common symptoms started to develop in him. And so the symptoms really are kind of the same, but I think that was one of the newer symptoms that we started to learn that developed later on.
So I've heard that it has affected blood pressure as well as inflammation. Is that true?
Well, I believe, let me first say all of those things could possibly be true, because all of us respond and react to viruses completely different. So I want to make sure, if all of a sudden you have high blood pressure, I don't want you to run out and think you have COVID-19.
Right.
However, if you are an individual who typically has an underlying medical diagnosis, as you all now know, that the common term that most of the common public knows of comorbidities, hypertension, diabetes, kidney disease, etc. Now that can absolutely then impact, because your body is very adaptable. Our body definitely responds to any changes that happens. And when it does so, it then can increase your blood pressure, your respirations can increase, etc. So it's not that hypertension could not be true, but if your body is seeking to fight off a new virus, then yes, that could be another symptom as well.
And in the beginning, we were talking about the elderly, people with compromised immune systems, and not affecting children. Has that changed?
So I wouldn't necessarily say that it's changed, but the numbers now that this is week 14, and now that we are able to really get more granular into the data, and the statisticians are working diligently to give us all those specific details, quite frankly, the answer is no, as you're aware. There's been I can give you some specific numbers. In the District of Columbia, there have been many cases from the ages of 0, to 4 years old. I think there's been about 70 plus cases where you have young individuals from, infants all the way to young toddlers that have been impacted and have succumbed to the COVID-19 virus. However, you look in the state of Virginia, and the common age of the infection in Maryland is 40 to 49. That is the average age of individuals that have been impacted in Virginia. However, the number of deaths that have occurred in Maryland, the majority of them did take place were 80 and above. So there's a difference when we're speaking in numbers. It's really important for those that are watching and to understand that there's a difference in the number and the common age of people that have been infected with COVID-19 versus the number of individuals who actually have passed away. So again, using Maryland as an example, and for those that are watching, please feel free. You've watched me multiple times on Shaunte. I always say go directly to the cdc.gov website. If you click on any of the maps of the states here in the US, it will give you that granular data. And if you do, again, click in on Maryland, it will indicate that 1,030 individuals in Maryland of the 2,270. So nearly half of the deaths that have occurred in Maryland occurred with individuals that were 80 and above.
Wow.
But the common infection rate are those individuals from 30 to 49. I'm sorry, 40 to 49.
Okay. So in your earlier videos that I've watched, you were talking about the surge and being prepared for the surge to come. Mm-hmm. And I know that all of the jurisdictions had projective numbers of what they thought the surge was going to look like and how the virus was going to impact. So that's why, in my opinion, or my thought, that's why we needed enough ventilators and enough hospital beds and all that. So how has DC, and if you know Maryland, how have we fared with what the projections were versus what actually happened?
So a great question. And I really want everyone to know, none of us, I'm a woman of faith, so I have no problem saying this. No one's God, right? So none of us have, telepathy where we can just assume what's going to happen and project into the future. We don't have a crystal ball. And so what I do believe that took place, and that was done very well. You have a group of epidemiologists and you have statisticians that are looking at the data when it first started to happen. And then I'm not a public health nurse, but what I know are there are public health officials that literally try to figure out where and how outbreaks take take place. And there's a difference of really understanding when things are contained, and then when you're trying to move into a mitigation phase and a containment phase. And right now, a few weeks ago, we were kind of in a mitigation phase, like understanding what is going on, what's happening, where is it coming from, who's commonly getting infected. Here in DC, as you just mentioned, our mayor today just posted and had a press conference where she indicated that we did have 14 days of a consistent decline in numbers. And basically where she came up with that idea from our public health official, Dr. LaQuandra Nesbitt, who is our leader for DC Health here in DC, basically DC's physician, as a public health official. They look and work with, again, the statisticians and the epidemiologists to understand where, who, and how these individuals are getting infected. So when you talk about the surge, it's really just projections from those numbers. I do believe DC specifically has done an amazing job. Our mayor, I believe, had daily, if not every other day, press conferences, understanding and explaining where and how we would be able to care for those patients. We all are quite aware of what took place in New York City, where they actually had the USS Comfort come to really say what happens if they continue to see more patients. And obviously there's only so many beds in a hospital. And how are we going to be able to still provide quality, safe care to these individuals? Well, we're all now aware they didn't have to really use USS Comfort, because at some point they also opened up other facilities. So here in DC, everyone has to understand hospitals operate at their operational capacity and also how many licensed beds that you have. So for example, a hospital, I'll use a hospital that I won't mention that I worked at years ago, were licensed, meaning the Department of Health said you can actually have 350 beds in that hospital where you can care for 350 people. Think of it in a hotel context, 350 actual beds per patient in your hospital. However, most hospitals do not operate at 100% capacity, meaning typically most hospitals on average, and here in DC, Dr. Nesbitt spoke about this, the average hospital functions at about a 75, which is kind of a higher number, or 80% rate, meaning that you still have other opportunities. Most hospitals, some of those rooms are double rooms, that were converted into private rooms. You can look at the spaces that you have in PACU, the recovery bays, if you've ever had an operation procedure. You can look at, if you have an auditorium space. So what they really wanted to do in preparing for the surge, and I'm sure this is true throughout the country, all public health officials had to look at the hospitals and say, how many beds do you have? How many beds are you able to staff? And that's another key impact as well. It's just, again, just because a hospital has 1,000 bed capacity doesn't mean they are operationalizing at that capacity, meaning those beds are staffed and you have nurses, physicians, et cetera, to care for. Very, very long answer, but it's very important for people to understand and what that really means.
Okay, so you were in talking about the surge also, you spoke about all the things that you needed. Will we have enough ventilators? Will we have enough protective gear? So how are the medical facilities, or do you know, faring with supplies? Do they have everything they need? One of my clients actually that I'm selling a house to right now is a nurse, and she was telling me that they're having to reuse or figure out a way to clean masks, and they just don't have enough. So from your perspective, what do you see?
So I would honestly say where I work, we have plenty of PPE. I think the conversation might be completely different. Maybe 4 or 5 weeks ago when you were in New York City, that was clearly an anomaly. It was not a normal thing. And yes, it is true. Many facilities in preparation for what may come are trying to ensure that they have what we're terming PPE conservation, where we are seeking to really make sure that in the event there is another major surge, that we have enough gowns and masks to protect ourselves. Now, gowns are not asked to be reused. The PPE that you're speaking of regarding the actual N95 masks, they are with the persons who create and develop them. They have did studies and said that I'm aware of, one that I'm aware of, that you can actually have that mask cleaned and sterilized up to 20 times. Many
Okay.
facilities are not doing that, but what happens is there is a specific strict protocol with ensuring that, you know, for example, I put on a little makeup so I can look cute today for you. If there is lipstick or something on the mask, that mask can then not be used. If the elasticity on the loops is not functional, that mask cannot be used. And so again, it comes directly from the manufacturer. It has been approved from the CDC that these masks can be, I don't want to use the word repurposed, but can also be preserved in the event of a major surge.
Wow. So today,
And I wanted to add on at that too, the ventilators. The ventilators is really key. Here in DC right now, there's 214 ventilators in use for COVID patients. So that's just in the District of Columbia that I'm speaking of. And we have an additional 226 ventilators available. What typically happens when you work for major type hospital systems, you know, like the Mayo Clinic or MedStar or Hopkins or something, where they have several hospitals in a conglomerate, you are able to cross cover and use each other's equipment if necessary. So for example, say here, and again, I'm not speaking on behalf of any organization, but I'm just giving an example. Hopkins also is affiliated with Sibley. So say Hopkins in Baltimore ends up having a major, it doesn't even have to be COVID-19. Say there's a major disaster that occurs in Baltimore and they need more ventilators. Well, they will reach out to the neighboring hospitals and say with their supply chain management team, hey, we need to borrow 15 ventilators. But Hopkins is also connected with Sibley Hospital here in DC. And so because they're a part of a system, and if Sibley is not having, you know, they might have an additional 100 ventilators, they will then transport those ventilators to a place like Hopkins in Baltimore so they can use that.
okay. So we have talked about questions ahead of time, but one of the things I wanted to throw in is today I was listening to Governor Hogan talk, and he was talking about the fact that Maryland has successfully completed over 300,000 tests, which he said he was proud of, and that they were opening up 2 more facilities for testing in Clinton, Maryland, and Six Flags America was going to be a testing center. And he was saying a lot about positivity rates and what that means, or that he was proud of the positivity rates. And I totally didn't understand what he was saying because I'm not a medical professional. So can you share what that actually means?
Absolutely. And that's a really, really great question, as I'm looking for a note that I wanted to also share regarding that. So the thing about positivity rates is really understanding the type of test that's happening. So there's a type of test, serology. So serology is when you're actually getting a lab blood draw test.
Okay.
And so those blood draw tests, what happens, that is testing for antibodies. And what that basically means is that it's testing to determine whether or not you have been exposed to the COVID-19 virus versus, and that does not mean that you currently are actively infectious or currently actively ill. It just means that you have developed antibodies, meaning that at some point you have been exposed to it, but it doesn't mean that you are currently actively positive, if that makes sense.
Mm-hmm.
Then the nasal swab testing, the difference with that is testing for the presence of active, you know, DNA, RNA cells that, and typically you would be symptomatic when you're testing that way. And so what the positivity rates are, and that goes back to planning and surging and understanding what the public health officials are indicating, the different types of tests mean different things to those of us in the healthcare field. So me, for example, I have not been tested. I have been in patients' rooms. I've touched for positive COVID patients. I have a husband and a son at home that obviously I'm concerned and care for. So who knows that, and as you and I know, I'm still trying to work out, still trying to stay safe and healthy myself, but it doesn't mean that I may not have had COVID, because as we all have learned, many people are also asymptomatic. So I could have possibly been exposed and or have had COVID, but just not, I haven't been tested. And so that's a difference of positivity rates. So if you test me now today, what he was sharing is that the CDC is recommending that you have at least a 5% or below positivity rate, meaning active current infections, if that makes any sense. Mm-hmm. And so just because I have been exposed maybe a month ago when this first started and I get tested today, and that adds to the positivity number, but Meedie's fine. Does that make sense? And so it doesn't mean that I have an active infection. And so understanding the PCR testing versus the serology testing, the blood test for antibodies, is two completely different things. So that's really what the positivity rate is. The positivity rate that we want to see completely decrease are the current active infections.
Okay. And is it true that DC had a day with 0 deaths? Did that happen yesterday? What day was that?
To be honest, I don't know if we had a day with 0 deaths. I did not see that, and I apologize. But if anybody is interested, if you go to coronavirus.dc.gov, I did not go back for every day this past weekend, and that the data is there. Literally, it's broken down day by day.
Okay, because I know that in Maryland, also Brooks, our county executive, was saying that we've had steady 9 deaths, and until we have less than, I think it was 3 deaths, they would not, she did not want to open up, which that we're going to get to the opening up thing in a minute. But
and Prince George's County is definitely a hotspot. I mean, you all have 14,100 positive cases and 496 deaths. And so again, that's a perfect example of really understanding, and even though you have more positive cases than Montgomery County, but you have less deaths than Montgomery County as well.
Wow. Okay. So a few minutes ago, you spoke of you, the mom, and you, the wife. And one of the things that is very concerning to me, because I do have family members that are also in the medical profession, about your own mental health and your own just in general health. So tell us about that. How is Meedie the mom and Meedie the wife, and how does she interact with Meedie the nurse and the nursing leader? How are you doing? How are you getting up every day doing this?
You know, if I'm very, very transparent and honest, it's hard. And as I'm talking, I want to pull this shade down. Sorry. It's a challenge. You know, again, I'm a person of faith, so I pray. And I really just ask God to continue to cover not just myself, but obviously my team. When you end up having several of your team members who did test positive, and you wonder, oh my goodness, you know, what happens, but you don't know the etiology of that. There's no way to confirm if that happened at work or within their own private home settings. As I just alluded to earlier, I ensure that I make that time for myself as it relates to, you know, working out, running and walking. I'll do that with a very dear friend of mine. And also sometimes my husband and son will join me. And then there's times I do it by myself just to have that mental release and really, really just stay focused and know that this is a calling. You know, none of us have ever lived through a pandemic before. We don't know. There's no textbook on how to respond or how to react or how to be a nursing leader or any healthcare professional, quite frankly, during the time of the pandemic. And so for me, it is really just eating well, being very intentional about, you know, my place of mental respite, which is, you know, walking or running and just working out, talking to friends, and people like yourself who have been such a blessing. And I definitely want to give you a shout out again, and people like you, Shaunte, that where I've received literally over $5,000 in donations to feed my team. And believe it or not, even though you are not the person who's here, but you sent the money and you paid for it, that means so much because my team is so appreciative. And so as a leader, if your team is happy and in a good place and in a good mental space, and you're not stressed about really managing their anxieties and fears, you can then make sure you're okay. You know, as a nursing leader, oftentimes I'm more worried about them, and then I don't think about myself until I get home. Sometimes, you know, I could be maybe a little short or not as patient or not as loving, if you will, with those that you live with, because you're bringing all that home every day. 14 weeks of this was a very, very long time, and I don't see the end of it necessarily anytime soon. And we have now adapted to this new norm. So that's what I do. I definitely miss my church services. Shout out to New Bethel Baptist Church here in DC. But I'm grateful for, you know, a pastor who prays and leads and sends me a text to check in on me, my first lady. And those things have been very, very helpful and rejuvenating from a spirit perspective.
Yeah, those online services have saved my life.
Absolutely.
Like I watch every single Sunday.
The other day, something kind of took place on my department. I'm like, I'll be right back. And I literally went back and I found an old service from the other Sunday. I think it was actually Easter service, was amazing. And I'm like, okay, I'm just going to sit in my office and have this little playback for about 15 minutes to get my mind right.
So important. I have a cousin who is a occupational therapist in a nursing home. And she was saying to actually this morning, because I talk to her every morning on her way to work, that it's just so hard to get up every day and then to put on all the protective gear. And she actually said the seniors in her facility are doing very well, that they have not, she has not had any, people have tested positive, but most of them they haven't had any deaths in her facility. But she said the part that scares her the most is actually coming home and dealing with the people in the streets, which is where we're going now with opening up, going to the grocery store and not seeing people in masks, or seeing kids in her neighborhood playing like it's not COVID-19 going on.
Yeah, I feel safer in the hospital, quite frankly, than I do out in the public, which is crazy, right? You would think, well, there's all these positive patients here, but knowing that we're doing the right thing, we're washing our hands, we're wearing the mask, when you are out there and you see people who cavalierly are not really, in my opinion, not necessarily taking it as serious as they should, whether it is, okay, if you're not going to wear a mask, but if I have the mask on and I'm on the sidewalk, well, who's going to move first, who's going to do the 6 feet distancing? And if I'm right on the curb, well, I don't know, walk in the middle of the street. Right. And so you see people just, no mask, or, seemingly oblivious to what is really happening. I think it is unfortunate, a sign of, quarantine fatigue, this pandemic fatigue. And exactly. So.
It's so scary. So, I've seen a lot of gatherings, a lot of parties, a lot of people hanging out on social media, and it's very, very scary to me. I want to comment when I see it, because I'm in the house and I've become accustomed to being in the house, but I'm in the house because I'm so fearful. I have a 75-year-old mom who lives with me. I have a child who suffers with asthma. And so it's very important. And I've been out there, but I've been extremely careful. Like yesterday, I went to a UPS store, and the one in my neighborhood, everything was good. The line was 6 feet apart. They had tape. And the line was so long, which is frustrating. Wegmans is like that too. The line is around the corner every day, and they're doing a good job at all the stores here. But I was kind of impatient. I went to a different UPS that was nearby, and completely different. The whole store was full of people. Nobody was social distancing. The people behind the counter, no, they had on masks, but under their nose, and
which is ridiculous.
Which is ridiculous. And I just looked in there and turned around and went back out, and children with no mask at all. I couldn't believe it. So I personally don't believe that we are ready to open up, but I'm curious as to what you think. What is your opinion on this opening up thing?
That's a loaded question. The scientific side of me says yes, as long as people, but that is depending upon people's behaviors. Yeah. It's depending upon people being compliant. It's dependent upon the Shaunte being patient and staying at that other UPS store in the 6 foot line, appropriate distancing and waiting her turn versus and I'm glad you left, because all it takes is one person that might be really sick to have a big sneeze. And I know that you mentioned about that earlier, and you're in a small environment, understanding that is a difference. And I'll get to that after I answer this part of your question. That's why I feel that, yes, on one hand, we're ready. And I do agree with some of the phased opportunity. You don't want to just open up the floodgates. However, people need to really understand what someone else does or does not do directly can impact your health. This is completely different than, any other major illness that we've dealt with. However, if you reflect back to H1N1 a few years ago, and the importance of hand hygiene, coughing in your arm and not, coughing in your hands and then touching things, people really don't understand how that can also impact other folks. Because if you come right behind and touch the door and then rub your nose or I'm a contact wearer, so I'm often, readjusting my contacts. Just because I touched something that Shaunte sneezed on, I'm now in the ICU on a ventilator, And so that's a difference of COVID-19, of how it attacks our system. And so, yes, on one hand, if people are really compliant and people are wearing the face coverings when they're out in public, or as you indicated, 6 feet distancing, etc. If we do that, I think we'll be okay. If people are a little hyper vigilant about that. However, my concern about not opening is because how are you going to enforce that?
Yeah.
So what happens? And I know we're here about COVID-19, but let's not talk about just even the recent brutalities that have occurred. So my concern is, well, what happens when one officer decides to enforce, my mask is here versus here, but then not with the other individual? Then it's going to create this dynamic within our society of, well, who are you to tell me to put on a mask? So there's no easy answer to that question.
Yeah, and coming home to have this conversation with you, I was listening to Governor Hogan about opening up this Friday and all the things he said that we're going to open up. So he was talking about restaurants, eating outdoors on the patio. That makes sense to me. We can social distance. But then he said day camps will be open and children and daycare camp teachers will have to have masks, which is like, really? And swimming pools and practice fields. And he said a lot of things that I was just like, I just don't even have a clue how you would actually social distance, especially little kids at a day camp. That just makes no sense to me at all. So yeah, I don't know. I'm definitely
Here's what I would say. You need, not you, Shaunte, but you, those of us that are watching, you need to make that best decision for you and your household. You need to, at this point, truly be in control of phase 1, 2, 3, or 4. Whatever the phase is, you decide when you believe it's going to be comfortable for you and yourself. As you indicated, a daughter with asthma. Well, I wouldn't necessarily recommend she's, hanging out with, 15 of her girlfriends or 10 of her girlfriends just for the fun of it. Now, maybe if it's 1 or 2 and those young ladies or young men and they're watching, then if you have control over that environment, then you can make that decision. And I think that's what's key. So we need to understand that the politicians are making recommendations from different perspectives. Yeah. And I understand they have a country or a set of constituencies that they have to adhere to and report to. And our economic environment is very dear to all of us, right? You yourself as an entrepreneur and a business owner, you need to continue to do what you need to do to sustain yourself. However, you need to make sure that you're doing those safe practices. So when you sell that next $1 million home, you may not give them a big hug, you might give them a fist bump, so happy, etc. So those are the things that I believe everyone needs to know. Make those best decisions for yourself. They are coming off of a very guided principle from other individuals who are making recommendations, and that is what it is. It's recommendations.
Yeah. So I've been hearing a lot about the vaccine. Do you know anything about that you can share with us?
So yes. Basically, long story short, obviously we all know of the household name now, Dr. Fauci. Mm-hmm. So let's just pause for a moment. You and I are both college educated women, and we understand that there's a thing called an IRB, the Institutional Review Board. Whenever you are doing any studies for a graduate degree or something of that nature, there's a long process to even get your idea to be approved to then go and do the testing. That's even if you're just doing interviews, let alone now you're talking about medications. Right. So he said, because this is again a pandemic, so this is all hands on deck. Everyone at NIH, CDC, et cetera, is working very diligently, the scientists, to come up with the vaccine. They also have to have a control group and a variable group to determine and various ages of people of various health conditions. First you will obviously want to make sure you're testing it in a person who's very healthy with no comorbidities. Then you might have to test it on a person who might have a respiratory issue to ensure it's not going to exacerbate any of that. And so according to him, 12 to 18 months. So if we go back from the time of January when this took place, well, 12 months from now would be, give or take December, January. Mm-hmm. And then you add on an additional, 18 months, for 12 to 18 months, so an additional 6 months. You're looking, sometime, what is that? May, June, July of next year. We don't know. There actively is not a cure for COVID-19. So I want to make sure people are clear. I want to also make sure people are clear about hydrochloroquine and all these other medications that are out there. Do not take them without the advice and guidance and supervision of your personal healthcare medical professional, not just a friend of yours, but a person who has been tracking you and knows your medical history. That's very key. And I believe when this vaccine does come, it's going to be very interesting to see who's going to want to be willing to be the first batch of individuals to take the vaccine. So we don't want to have anti-vaccine individuals. Many people are anti-vaccinations. However, when you're having a national pandemic such as this, and I'm sure you heard that term, herd immunity, meaning when you're all together in your household, then once you all get it, then you pretty much all have the same immunity from each other. Yeah. We'll see what that takes place. But for right now, yes, the vaccine, they have some human subjects that they're checking to see. I saw an article posted today for one of the gentlemen who, when he got the second dose of the vaccine, did have a little bit of complications, but it was monitored and he was okay. He was one of the healthy subjects. And so again, we don't know what we don't know. So we'll have to wait and see sometime December or June of next year. We'll wait and see.
Mm. Okay.
I like that big, long, pregnant pause.
Right. Well, so I feel for all the people who missed a lot of things, especially the 2020 graduates, and all the moms who didn't get to do prom and graduation. So what you just said impacts me because I have a junior rising senior. So to think that she misses basically her entire senior year is like, awful. So I know a lot of schools have been talking, I'm a former teacher, have been talking about how to reopen school and what's the safe way to do that. And I've had many conversations with many friends, especially friends of college students who say they don't care if school opens. They're not sending their kid back to school, especially college, until there is a vaccine. So I was just wondering from the mom in you, what are you thinking in reference to your own son? How do you feel about school opening up?
I am perfectly fine if school is not open until January. Mm-hmm. I think if the educators and the administrators of our educational institutions are able to find ways to do and I say that because how will you be able to, particularly during the fall when that is prime time, flu season anyway. I have a son and, how are you going to be able to ensure, the desks are 6 feet apart? How are you going to be able to ensure or mandate, if you will, hand hygiene? How do you monitor that? Are they going to line up at the door every day and give them a squirt of Purell in their hands? Yeah. How does that take place? What takes place for the single parents who, guess what, you're going to go to school, then don't you cough on anyone, but I need you to go ahead and go to school because they have to now go to work.
That happens with those fevers. Yep.
Exactly. Take this Motrin, take this Tylenol and just suck it up and go to school. Mm-hmm. How is that really going to impact? And all it takes is one or two, individuals in a very small environment, as we've learned. I'm sure you probably heard about what happened in Albany last month down in Georgia at the funeral that took place. And literally from that one funeral, over 70 people were ill because of attending this one funeral down in Albany, Georgia. So for me, again, it's not an easy answer. I don't have the answer, but I'm okay. And that's because by the grace of God, I'm in an environment where, my son is a little bit older. So if he had to stay at home by himself for a few hours, okay, I can manage that. Yeah. He could feed himself, et cetera. And I have a place where he is safe. So the question is for those other individuals who have younger children who can't stay at home, and that's going to then impact their job. If their jobs reopen, you're not allowed to be at home. What happens? And African Americans, it's been reported multiple times now, only one out of five of us, Shaunte, have jobs where we can work from home, or one out of five or 1 out of 6, I believe it is, have active jobs where we are able to do telework. And so how is that going to really impact it? So it's not just a simple question of the physical safety. I'm sure all of us would say, yes, keep our kids at home, but then there's way more to that in that question as well.
That's crazy. It's so scary. My daughter's school has talked about doing like weeks on and weeks off. Mm-hmm. So I don't even know how to, they're thinking if they're lower the capacity that it may work, but I'm with you. I'm okay. I'm good with January.
Yeah.
Online school has been fine, but I definitely empathize with people who have small children, elementary age children. It's very, very hard to manage, and it's impossible to have a job and manage your kid on virtual school. So
Absolutely. Many of my friends talked about that who have younger children who are able to telework. As you can see, people busting in the door, you're in the middle of a meeting, with an executive or something, and you're in, mommy, I'm hungry. How do you manage that? And so it's definitely very challenging. Absolutely.
It's very, very difficult.
We're not
So
even talking about the social economic divide of people who need, maybe they're, banking on that school for breakfast and lunch for that day, and so there, again, that's a very, very difficult question and a hard decision that's going to have to be made, particularly for those that are in non-private schools, settings for the public school system. How are they going to manage that?
yeah. So one of the things that I actually cried real tears about was one of your videos where you showed, or maybe it was a couple of videos, where you showed people actually leaving the hospital.
Yes.
And everybody was cheering. I'm about to cry now. People had signs, and it was so beautiful. So I know that you see a lot of death, but you also see a lot of success, and people actually get to leave the hospital. So what do you want to share about that? Because what is the positive in all of this? I mean, is it just, do we have more? You tell me, what is the positive in all of this?
I think, well, you spoke it into existence. What you just said is that there are, I know that was one of the questions you and I had talked about earlier. Yes, obviously there's a lot of death. Yes, there's a lot of positive cases, but there's also a lot, and I don't have the exact number, but there's way more people who are recuperating and recovering from COVID-19 than the deaths. And so again, that goes back to our early conversation about understanding positive rates and what does it mean, and understanding, vaccinations, understanding testing, understanding the difference of serology testing versus the PCR testing when you're getting the nasal swab test done. Mm-hmm. And so the positive is exactly that, seeing, particularly for some of the patients, that are very enlightening. And I think what you're speaking of was an individual who was on a ventilator for several weeks. Yeah. And so a lot of those patients, when you're on a ventilator, quite frankly, minus COVID-19, anyone. I'm a cardiac ICU nurse by trade. And when I was on the unit, when we had those patients who were on those ventilators or those heart balloon pumps for more than a week or 2 weeks, the prognosis gets very, very grim. And so the positive in this is that nurses and physicians and other healthcare professionals, PT, OT, et cetera, the people in the lab, I don't want to leave any of them out, any healthcare professional really have become innovative. And so a lot of people, for those that are watching that are healthcare professionals, having a person on a ventilator and a turned on their stomach, they're doing prone positioning now, where they're able to put a patient basically on their stomach, still have the breathing tube in, so that way they can help to mobilize the phlegm and the buildup and the mucus buildup that COVID-19 causes in your lungs. And so to understand, this is a gentleman that you're speaking of that unfortunately was on a ventilator for a very long time, and was able to come out and completely have his mental faculties and was completely alert and oriented and was able to walk, is amazing. And so we celebrate those often. I know, at least where I work, there's music that plays, "It's a Beautiful Day." And so often, every time a patient who is discharged from COVID-19, we play that as an uplift to remind us that our work is working and our work is valuable, and we do have success amidst even though we're in the middle of a pandemic.
That is so amazing. Oh my God.
It is.
So back to the opening up conversation. I know what the precautions have been. Have they changed? And what do you recommend that we do on a daily basis? Like, I know at one point I was leaving my Amazon boxes outside for 3 days. I've been wiping down my groceries. I clean my counters and all my surfaces like all day long. I'm completely a germaphobe now. I was not before, but I completely am now. I had no idea I've taken my car to get sanitized. I had no idea how dirty things were until this. So what do you recommend that we do as just general precautions to keep ourselves and our family members healthy?
Can I just first start off by saying, Shaunte, that whole issue of novel idea of washing your hands completely exploded my mind. I'm like, we do this every day, people. You should be washing your hands all the time. That is not a new thing. Not sneeze in your hand and then go and shake someone's hand or touch a doorknob with all this moisture on your hand. So when it first happened, I'm like, people, come on. This is normal, basic daily hygiene practices that we should be doing, that we were taught in kindergarten. And so I was amazed by the many reminders that we had to say early on: wash your hands, wash your hands, wash your hands. I'm like, yes, please, please, please. However, to answer your question, the precautions remain the same. Wash your hands. I do believe that we should continue to wear the face coverings, regardless of what setting you're in. Even if you're going out to dinner, if I were you, pull it down, kind of like you were talking about earlier. Have one here. If you have it, if you want to pull it down, and then you eat. And then when you're done eating, then pull it up, because you never know when you might sneeze or something like that. And so until we know and get a handle on what COVID-19 is and how 100% sure we are how it's contracted, that shouldn't bother you. So just wash your hands, do the 6 feet distancing as they shared. And the rationale for that is because of respiratory issues and droplets. And so understanding airborne transmission and droplet transmission. And the difference is this: think of an individual who smokes. And you can be 10 feet away, but you still smell that it's in the air. It is now aerosolized, that you can tell and smell that somebody just, blew a puff from a cigarette. So think about that, and think about the particles that you now smell in the air, and imagine you're breathing that in, right? The difference is with droplet precautions is if Meedie sneezes at you, the theory is those droplets typically don't travel beyond 6 feet. So if I just say achoo, and we all know when it gets a little moisture, those are called the droplets. They're not going to travel, and they're heavy, and they're going to fall directly down to the ground. That's the difference of airborne and droplet precautions. And early on, remember, in the beginning of March, they were not recommending that we all wear masks. But then we realized from just speaking or talking or singing, and if I'm standing here now, that transmission. So again, think about the person, who smokes. Think about just talking and you're in that airspace.
Mm-hmm.
That's when the recommendation was, hey, maybe we should put on a face covering. So for me, wash your hands. I don't think we necessarily have to be as germophobic but we should be hyper vigilant. I don't think that there's anything wrong. I'm getting a lot of Amazon packages as well. Just have a thing of Lysol. I just spray the box down, because another thing everyone has to understand is there's a thing called viral load. And so I could achoo, and then I can go achoo, and there's a whole bunch of stuff on my hand. So when my hand is with that larger sneeze, there's more viruses on my hand, if you will, viral cells rather, on my hands, because the load is more, if that makes sense. Mm-hmm. So you also have to understand, so when they tested and swabbed boxes and et cetera, yes, but there has to, the likelihood of transmission from that, it can happen. I'm not saying that it can't. It can happen, but the majority of what they found, it was from person to person, not from surfaces per se.
So I'm obsessing when I clean my groceries?
I mean, there's nothing wrong with being cautious. I just think, again, it's because of not knowing. And I think the unknown, right now we're in an environment of being comfortable with the unknown. And that's what's really scary, because we don't know. And even now, I don't have an exact answer for that. I don't think there's anything wrong with taking the necessary precautions, understanding your own health, your daughter's health, and elderly mother, just to be cautious. But I do think, again, if you have a bottle of Lysol, preserve it, spray the box down.
Any Lysol? They don't have that anywhere.
Try Amazon again. I don't know.
Right. So that was the next thing. So at first it was toilet paper and paper towels. It was like, people, why do you need so much of this? So now
toilet paper is back now, though. I've gone to the CVS by my house, and there has not been any toilet paper there for literally the last about 10 or 13 weeks. And I've gone there this week twice. And each time I've gone in there, there's been toilet paper there.
Listen, some really smart person started a Facebook group called the PG County Merchandise Tracker.
Are you serious?
Literally, it's like 9,000 members. Literally, someone is in the store, they see Lysol or whatever, they post it, and like it sells out in milliseconds. It's crazy. I've been trying to find Clorox wipes, Lysol, whatever, some type of real. I've never had a can of Lysol in the whole, as long as we've been here. I haven't had any.
Well,
So
fortunately, my husband has a nickname, and so he always is kind of like you were saying, a germaphobe. So even before this happened, we've had several bottles of Lysol in my house, and I actually had one in my office. So we've been okay with the Lysol spray. If it gets that bad, let me know, and maybe I'll give you a bottle.
thank you. Okay, so do you think? So you basically said the 18 months. Do you think that that's enough time to really heal from all of this?
Absolutely not. We're not even, I say that emphatically because I don't even think we're going to understand the untold consequences or the collateral damage, if you will, of not even just the unfortunate, 1.6, 1.7 million lives that have been impacted from COVID-19 that have been positive. And now, the nearly, and it might be at 100,000 by now. I know when I looked earlier today around 3:30, we were still at 99,783 deaths in the US. And so we've been reaching 100,000 deaths. We don't even know the other impact of, what frightens me are those individuals who should have come to the hospital and who did not come, or the people who will now find out that their, stage 1 kidney disease is now, complete end stage renal disease. The individuals who prolonged cancer treatments because of fear of coming into the hospital, patients who have had hypertension issues and now they have cardiomyopathy or cardiomegaly because of their blood pressure has been so high the last 2.5 months that they have not gone to connect with their physician. So those type of concerns, Shaunte, we won't even know for a year or 2 years once this is done. I think when we get to the end of the curve, I don't think that COVID-19 is going to just disappear, but I do think prayerfully that we will get to the point where it will have less and less numbers. But I do know, and I can only imagine the impact that it's going to have, like I said, of what I'm terming as the collateral damage, and the impact that it's going to have on those non-COVID patients that for whatever reason did not get the medical care treatment that they should have sought out prior to this pandemic taking place.
Yeah, in early March, I would say I had a party for my daughter for her birthday, and it literally was 80 children in my house on March 1st, well, February 29th. And that
So
Monday,
about 2 weeks before this all took place.
so that Monday, my daughter was sick and my mother was sick. My daughter, always hers is respiratory. It was very productive. My mom just had a really dry cough. So everything my mother was displaying was everything they said was signs of coronavirus. My daughter, I took her to the pediatrician immediately, and the pediatrician actually said he was very annoyed. Like, I don't know what all this hype is, about the coronavirus. I would be more concerned about the flu than I am about, than we are about the coronavirus.
I said the same thing initially. Absolutely.
Yeah, he was like, I just think that, we're just all in a frenzy for nothing. And then my daughter ends up getting better a few days later, but then my mom didn't get better. Her cough actually got worse. And so I took her to Kaiser, and it was a long journey, because the rules kept changing, because she had the cough and she had shortness of breath. She couldn't even put her shoes on without sounding.
Oh, wow.
And so I was very scared, and she has Kaiser. And so we went there, and everybody was hazmated down. This was March 7th, I think. And we were there for like 8 hours before they actually gave her a test, because it kept changing. But by the time, I kept advocating, saying, clearly she has a compromised immune system. She has Crohn's disease, and she has at least 2 of the symptoms. It has to be a way you can give her this test. And so ultimately they gave her the test, and she did not have, she tested negative, but it was just really, really scary. And so what do you think, since we pretty much passed the big wave of the flu, because one of the things the pediatrician said is that, more people die from the flu. We're not, We
Well,
don't have
that was true before these latest numbers. I mean, people don't realize that over 20 to 30,000 people a year die from the common flu,
yeah.
and that is true. Yeah, that's true. That's why, again, think about, I forgot, a few years ago with the H1N1. Think about the flu season. Think about, that's why every year the scientists are also working diligently to determine what type of flu vaccine to create, because that vaccine is altered based on the current active strain that is out there.
Well, that's
What I would share with you regarding your mother, Shaunte, is that doesn't necessarily mean that she had the nasal swab done. Is that what the test she had done? So what I would inquire, maybe her next follow-up, or as this testing has continued to evolve, is it doesn't mean that your mom didn't have COVID, quite frankly. She could have had a false negative from that test alone. I personally have a friend who the ER physician said to her, I'm sure you have COVID, even though your nasal swab came back negative. She's a young, healthy woman in her 30s, and ended up getting, not feeling well, was very healthy, exercised, worked out, no comorbidities, anything. And then all of a sudden just had the worst, flu-like symptoms, hot, the cold, the chills, the hot, the cold, the fever, etc. And her test was negative, but then she gets a chest x-ray that we both advocated for her. No, let's get you a chest x-ray. She had bilateral lobe pneumonia.
wow.
Out of nowhere. So, and the physician said, if you remember, I talked about that whole viral load. So if she had more of the pneumonia present than the actual COVID-19 present, maybe that's why with the false positive, she didn't know. And so her test was a nasal swab, again, which tests for active infection, whereas the serology testing, the blood testing, tests for the antibodies that will then determine whether or not you have been positive. And even just hearing what you're saying, just logically think, 80 plus people in your house celebrating your daughter, the likelihood of someone having a slight cold, yeah, and it's during, the cold season, the likelihood of somebody having a little something and they're young and otherwise healthy, they probably, again, were those asymptomatic carriers. And then, because how else, if your mother was not out there around anyone, well, how else could she all of a sudden have these
Leave the house.
Exactly. So, when you logically think, how else could she get those symptoms? And that, my friend, is how they're now working with these contact tracers when they're doing the more testing and understanding. So say your mother went and got tested today for the serology test, and the blood test came back, says, yes, you're positive for antibodies, meaning that you've been exposed. Well, then they would then go back and track, okay, what day were these symptoms? How long were your symptoms? How long did it take? And so those are the testing individuals that they are now training to do when you talk about contact testing.
Well,
And that also
anybody
goes back to your previous question about the reporting of the positivity rates. So your mom and your daughter were sick back in March, but if they go and get tested today, which is May 27th, those numbers are going to be positive today, but they really were infected back in March, not May. So that's why the numbers sometimes can be a little skewed.
So I'm just,
it's a lot. It's a lot.
I had another question based on what you just said, but I lost it. That's okay. So, wow, this has been a really, really awesome conversation. Do you have any last words on COVID-19 before we go?
Really what I want to share is that as leaders, and even what you're doing, Shaunte, this is an amazing platform. Sometimes social media can be used for nonsense, quite frankly, or just for fun and games. But I do think having social media platforms such as yours and even mine is just really giving my perspective as to what I see. And I really want to let everyone know, even myself, Shaunte introduced me as an expert. I'm definitely an expert nurse. I know what I know. And one of my greatest mentors, bless her soul, said, Meedie, as a healthcare professional, be confident in what you know and confident in what you don't know. Yeah. And I've always led with that. And I've also tried to teach my team and those other individuals that I've sought to mentor in nursing. There are 5 key points: is, compassion, integrity, to also make sure you have a really good, strong work ethic, to have great teamwork, and to also be a great communicator, specifically meaning, communicating the truth and what it is that you need, because nobody can read your mind. And I
Right.
think right now, during this time of our pandemic, if there was if I had a large audience, what I would simply say is, let's hold our leaders' feet to the fire and make sure that they are communicating to a point where we can trust them, that they are communicating with clarity, that they are also communicating with compassion, and for us to not politicize anything about this pandemic, because people's lives are at the end of what's taking place. I can often, again, you're a business owner. So if I were you, you might clearly have a completely skewed view of, open up, I need to sell these houses, I got to get my business together. I get it, because that is your livelihood.
Yeah.
That is how you pay your bills, keep your light on, you feed your family. However, from a strictly health perspective, I'm looking at it strictly from a health perspective. People's lives are at the end of what is happening. And the Bible is very clear that talks about life and death is in the power of the tongue. And I unashamedly am a woman of faith, and I want to let people know life and death is in the power of the tongue. So when you hear things that aren't true or that aren't accurate, or where the narrative is skewed of such, where you're not really clear about what the expectations are, to your point, okay, so do I go to the park or not go to the park? Do I go to the restaurant and wear a mask, or do I not wear a mask? That's why I encourage all of us to go to the website. I do, and this is not a political statement, but I do believe that our mayor, or at least here in DC, no one is perfect, but I do believe DC specifically, as a district resident, the data is so clear. And Shaunte, I know, you're in Maryland, but if you go to the COVID-19 coronavirus.dc.gov website, it literally has the infection rates broken down by neighborhoods. So you can know where the most infectious rates are, even here in DC. The data is there. It tells you how many ventilators are in use. It tells you how many hospital beds we have. It tells you how many positive patients are currently in hospitals. It tells you how many positive patients are in the ICU. So the data is there. And so for me, that is what we really need, our politicians to really lead. Right now, there obviously is head and there's obviously heart, but we need compassion. We need
Yeah.
people to speak to the non-medical professionals so that they can understand what happens when they are making decisions that directly now are impacting their own personal health and the personal health of those individuals in their community and around them. And lastly, I did a little quick post last night. Protect your mind. This is a lot. This is so much information. This is a crash course in epidemiology. This is a crash course in public health. This is a crash course, and I hated statistics back in college. This is a crash course in trying to understand all of these things, because it impacts you daily.
Yeah.
And that would be my closing message, is to be safe, be well, stay well, continue to get accurate, clear information. Do not dwell on all of the TV broadcastings about coronavirus. Watch it and then move on. And make sure that you do not allow the stresses to also negatively impact your general health as well, because stress does impact us. Stress, you talked earlier about hypertension from COVID-19. Well, if you're stressed out all the time, that can impact, increase your hormonal levels that aren't beneficial for you. That can increase your blood pressure, and all of those things have a negative impact on our health. So again, really wanting our leaders to please lead from a place of transparency, authenticity, and compassion, and make sure us, the end users, the citizens, are being diligent, and we are being mindful of our neighbors now more so than ever. Neighbors, not necessarily your next door neighbor, but just to be good citizens right now. Cross the street, wash your hands, wear the face mask. Don't bring grandma out into an environment where she or grandpa is going to get impacted. Don't have the party during the 4th of July with 50 people in the backyard. My son's birthday is coming up. Continue to have, the Zoom parties, or the parties, the mobile honk the horn parties and stuff like that, to protect yourself until the scientists and those people that prayerfully we are trusting are going to make the best decisions and come up with a cure and or an antidote for this virus.
Thank you so much. I've been watching us on Facebook as well. People are saying good information, great job. No questions on there though, but I do want to post the website once we're done. So can you just say it one more time so I can post it?
Sure. So for those that you're watching, again, you don't even need to go to CNN every day. Go directly to the cdc.gov, cdc.gov. And as soon as you click there, there's a banner bar. You scroll down probably a third of the way down, and it will give you all the data, and it will show a humongous map of the United States. You click on whatever state. If you're not here, Shaunte and I are here in the DMV, DC, Maryland, and Virginia area. If you're in California, Georgia, wherever you are, just click on that website, and it will take you directly to your state's Department of Health. And I want people to know that they are required by law to report positive cases. They're required by law to report the number of deaths as well. And so now, obviously, we can only assume that they're doing the right thing, but it is a requirement that that information is reported every day. And additionally, another great, if you're interested in what's happening worldwide and globally, go to WHO, the World Health Organization, WHO.int, standing for international. Again, www.who.int. And again, the World Health Organization has a plethora of information as well. And another amazing website is just simply if you go into the search banner, I forgot the exact tagline, but if you go into Johns Hopkins, and that's Johns with an S, Johns Hopkins University, COVID-19, if you just do a search, they have a humongous heat map that will also let you know jurisdictionally here in the DC and the United States, as well as worldwide, the number of tests and the testing information, as well as the positive and death information is listed there as well. And also resources are on all of those websites as well.
Okay. You said the other one was coronavirus.dc.gov?
Gov, G-O-V.
All right.
That's for DC specifically, coronavirus.dc.gov. And
Yeah,
if you,
that's for any jurisdiction, because ours is Maryland.gov.
if you go to the CDC website, and because I don't know, I forgot the tagline, but you can even go Google and just type in Virginia State Department of Health or Maryland State Department of Health, and it will take you right there.
Okay. All right. Well, thank you very much, love. You are amazing. You are brave. Oh my God, I totally admire you. You are doing great work. I worry about you. I pray for you. And I'm just so happy to have had this conversation with you. Much appreciated. It was great information. I learned some stuff. I know people watching learned a lot as well. And just thank you for being a leader and a beacon of hope for us during this crazy, crazy time. And keep doing those videos because I love them and I love watching them. So
Shaunte, you just gave me a quick thing, if I may, for 20 seconds before we end. Find the positive in all of this. You asked me that question earlier about, the patient that was discharged where I work, and, use this time to, clean your house. Use this time to start that business that you wanted to start. Use this time to be intentional with, your children are spending more time, and, your daughter is graduating high school this coming year, sweetheart, what are your plans in the next 5 years? And if she decides, for example, she wants to be a nurse, hey, well, why don't you call Miss Meedie and let's, use this time constructively to figure out ways. Use this time to get closer to God. Use this time to journal. The pandemic is obviously a negative thing in the context of, it's impacting our health, and God bless the many people. I cannot help but say this. I had another dear friend who lost his mother just yesterday from this. My heart is out for all of those individuals. So I know that. I want to be very clear. But for those of us that have not directly been impacted, and I mean directly meaning yourself or your immediate family member, find time to do something positive. Continue, if there's people that are donating, food to other, and not just for hospital workers, but for other essential employees. We're scared. Yeah. And I want to let people know that we are so nervous. I don't want to put this facade that, oh, Meedie's fine. No, I'm still nervous every day. I still wash my hands before I walk in. I wash my hands when I leave. I take off my clothes literally at the door of my house. Spray, Lysol my shoes. Thank God for my husband to wash my clothes separately, everything. And so life is not normal as it used to be. We are making adjustments to this new norm. But I really want people to know it's not all doom and gloom, and protect your mental space and just find something positive, whatever that means for you. Find something positive to do. Get out of the house. Yes, be socially distant, but walk around the block, do something that brings you joy, even amidst what's happening right now. And that's very, very important during this time.
Okay. Thank you.
You're welcome.
Good. We were on for 1 hour and 22 minutes. That was amazing.
Wow.
Yay. Thank you so much.
The Meedie and Shaunte show.
That's right. So if anybody wants to tune in to those videos that you do you want to share your social media with them? So maybe
Sure. So I am on IG at, what is my IG handle? Oh, at Meedie B as in boy, my last name. It took me a second. And my Facebook handle is Meedie Clark Bardonille, Bardonille. Feel free to message me or go to that page. It is not a public page, so just reach out to me and then I can like you there. I'm also on LinkedIn as well at my professional name, Meedie Bardonille. So thank you, Shaunte, for this platform. Thank you for the opportunity to share to your friends and your followers. Thank you for those of you who are watching. Again, there is Christ over COVID. There is faith over fear. There's still peace amidst this pandemic, despite the other things that are happening in our world right now. But please continue to just be safe, make those best decisions for yourself, like I said, and do what you know to do, because we got this. We are alone together, and so we can do this together. And if you're not sure, you have questions, again, reach out to me. If you have a nurse in your family or in your circle or a physician, or et cetera, reach out to them if you really just want to get some real basic information.
Well, amen, sister. That was very
amen.
Good. Thank you so much. All right.
You're welcome, dear. Thank you so much. Have a great night. Love you too, dear. Take care.